nevertheless, Bella is going to take us into an exciting topic coming from Kennedy Krieger, Bella Turk, speaking on spinal cord imaging in AMN.
Thank you. Do we still have the pointer? All right. All right. Hi, ladies and gentlemen. Very grateful to be here. Very happy to share our work on spinal cord imaging in AMN. There is a lot of fantastic work that is done looking at the biochemistry and pathology of the spinal cord, especially recent publications by Florian Eichler's group, which have been quite inspirational. Today, for my talk, I would like to focus entirely on just the imaging, take you a little bit through the story of the imaging of the spinal cord in AMN, and some of the work that we've been doing, developing new sequences, and I'd like to show and share with you some unpublished data that we've just started looking at. So our collaborators at Vanderbilt University, this is a long-standing collaboration. This is Dr. Seth Smith, a MRI physicist, an MRI physicist who has been developing the sequences to look specifically at the spinal cord, and the graduate student Richard Lawless and Dr. Bryson Reynolds have been fantastic in looking at the data, and my mentor, Dr. Ali Fatemi at Kennedy Krieger. So, imaging the AMN spinal cord. The story starts with a publication in 1995 in Dr. Köhler's group, where there's a reference to one figure, that's the figure down on the bottom on the left, an axial view, a cross-sectional slice right through the neck, where he points to this little gray dot, that's the little arrow there, and it's called diffuse spinal cord atrophy. As a comparison to that, on the right is my own spinal cord in the same sequence. Now, I do have to note that this was done in 1995, so the T2 image, that's the sequence used, was 1.5 Tesla. The one on the right is a 3 Tesla, so the image quality is very different. But back then, they already looked at the difference in volume. So the question posed is, is there a way to quantitatively measure this? And is this useful maybe as a biomarker of disease progression or for a future clinical trial? So I'm going to take us today through the imaging sequences that were previously published and that we're basing our work on, and compared to other publications out there. So the one I'd like to start with is magnetization transfer, which was first developed by Dr. Fatemi and Seth Smith in 2005, applied to the AMN spinal cord. Some diffusion tensor imaging with new data. I'm not going to get too much into the physics of these sequences, give a brief overview, volumetric analysis that we've been looking at, and then some of the very exciting new experimental research sequences, and I'll show you comparisons of the differentiation between white and gray matter in some of these sequences and their prospective use in AMN. Is there a little bit of feedback here? All right, thanks. I'll try and keep it the same distance away. So, MT, magnetization transfer. In a nutshell, MT targets fat, and it does this by applying a radiofrequency pulse to macromolecules of lipid species. So this saturates the fat, which is surrounded by the water molecules, spins the water molecules, and the water molecules, that creates the MT effect by lowering the signal. So basically, the MT shows the interaction of certain fatty species with water, specifically in myelin. And that's where we looked at its target in 2005. So the value that we're looking at in MT is called the MT ratio. You look at the native scan without MT, subtract the MT, and then you get this MT ratio. Now, the MT ratio itself has a high signal-to-noise ratio. You can't really tell what you're looking at But Dr. Seth Smith and Dr. Ali Fatemi in 2005 came up with a way to normalize the signal to each person's own CSF value, to the water around it. And by doing so, created a signal that in AMN was able to correlate with and show the pathology of the spinal cord. Here's on the x-axis, this is not over time, I'd like to point out, this is the slice. So this is going down the image as you go down. This is C2, C3 of the spinal cord, looking at AMN, heterozygote females and controls, and we see a big difference in the MT CSF of the spinal cord. And so based on this, this is a cross-sectional paper that was published. So this is one time point showing a difference between two groups, or three groups in this case. Here are the numbers. MT-CSF in 2005 was significantly different in AMN to heterozygote female to control, and this data was replicated in 2009 as well. And again, one time point cross-sectional. So the question, additionally, the question we ask in looking for a biomarker is this one time point, how does that change over time? What does it look like longitudinally? And does it matter? Does it correlate with clinical outcome measures? MT-CSF was shown cross-sectionally to correlate with EDSS and sway amplitude. So there is a clinical correlation. There is a meaning to these measures of the spinal cord. The worse they get, the worse the disability in AMN patients. So how useful is MT and AMN? Well, we know there are significant differences between them. We know there's clinical correlation, but can it serve as a biomarker for disease progression? Can we look at this value over time and see how it changes? And can we potentially use it as a biomarker for clinical trials? So I'd like to take you now to the new unpublished data that we haven't looked at, we haven't published yet. For this, we looked at the AMN data set from the old Lorenzos Oil Trial in 2005 to 2009. This hadn't been looked at yet. And this is historic data where 350 MRI scans of 148 patients were manually stored on magnetic tapes in single byte form that took about 4 months to reconstruct and extract. I literally bought a brush to brush off the heads of these magnetic tapes and load them into a robot that one by one overnight would read them. But we've managed to reconstruct about 740 gigabytes of data to extract these scans and start analysis. And within these scans, we managed to put together the pieces of the MT and DTI of the cervical spinal cord C1 to C3 that was done by Dr. Smith at the time. So this was very experimental sequences at the time, but they ran them in the Lorenzos Oil Trial. So our question, how does MT-CSF and then DTI perform over time as a measure? So this is the first look at MT-CSF of 2 patients. I'm just showing them, we've done about 40 patients so far, but in putting it together, it's very important to understand where they are before we just cluster them. So this is 3 years of the Lorenzos Oil study of MT-CSF in AMN. I don't want to make any conclusions out of it, and these are the only first data that I'm comfortable showing before we understand the data set a little bit better. On the right, you have a picture of the MT image with a 3D reconstruction, and on the left, 2 sample AMN patients. So right now, we're in the process of putting these data together and looking and seeing how they change over time and whether or not they would serve as a biomarker. And in doing so, it's very important to understand that AMN patients, as they're stratified clinically, they're in different severity groups and they differ by age. So comparing a young AMN patient to an older one, the level of change or the amount of change over time, the delta, would be different. The next thing, oh, I'm sorry, here. So the next thing we're looking at is volumetric loss. At the beginning, I said that one T2 image where it was pointed out that there was diffuse atrophy That was one person looking at a scan. Now, with modern techniques, we have the ability to automatically outline and segment, identify the region of interest, which is the volume of the spinal cord, and look at this over time. So with the same data set, that's what we've done. We've plotted them longitudinally, and we've looked. So far, with those few 40 or so cases, it doesn't seem to be that there is a significant change in volume of these spinal cord sequences. Now, they've all been registered to each other. That means we're making sure that we're looking at the exactly same cervical level, but 3 years doesn't seem to be a long enough time to see volume change. But then again, we haven't completed our analyses. These are very initial data. This is the first time we've looked at this. Actually, these data were just generated about 2 weeks ago. So we have to understand where and how this data fits together and looking at the volume loss in the spinal cord. I'd like to point out that there's a fantastic publication. Dr. Eichler showed this very briefly in his presentation. On the right, we see, so on the bottom is not over time. This is not how the volume changes over time, but this is by cervical level. So this is going up and down the spinal cord. On the very left is the top at C23, at the very right is the bottom. And there they show a wonderful change, a wonderful difference between control and AMN patients. So hopefully we can show that difference as well when we start looking at control patients, and we'll be able to plot a difference over time or not. I'd like to touch on DTI, diffusion tensor imaging of the spinal cord. This is a wonderful technique, and I'm just going to very briefly go through the introductory slide of what DTI is. It applies a very strong magnetic field to the image, and water molecules that move in the image lose their signals as they move. So this shows the directionality of water as dependent on these long tracts. And these long tracts are the white matter tracts. So the better or the more robust these white matter tracts, the less water movement there is. And this allows us to create a mathematical model of vectors showing which way the water motion can happen in 3 dimensions. So here is the new, never seen before cross-sectional data of DTI of the AMN spinal cord. On the top left is the fractional anisotropy. This is how able they are to diffuse in one direction. And we see a significant difference in fractional anisotropy, FA, between AMN and heterozygotes in the dorsal column and the left lateral white matter. So the reason I have this up on the left is because there was a recent publication by Dr. Lilo Politi and his group, and I'd like to compare that. And I've organized the plots the same way, the top left versus the top left. On the right figure, this is a publication from 2016. He also looked at DTI of the AMN spinal cord, and we show very similar findings when we are looking at the Lorenzos Oil data set. So we've looked at 20 AMN versus 20 heterozygotes, and we seem to find similar things in C2, C3 spinal cord level. Correlation to clinical outcomes. So this is our unpublished data. The dorsal column fractional anisotropy does correlate with EDSS, so clinical disability. So it's the question of what do these imaging parameters matter clinically? So when this parameter gets worse, does that mean that somebody with AMN symptoms are worse? And that's the question we posed here. And it correlates with the severity score EDSS and with sway amplitudes on a force plate, the ability to balance. I'd like to come to the third part, or the final part of my talk, these research sequences, or these experimental sequences. So here at the bottom, we have a clinical T1 sequence on the very left. This is a 3 Tesla sequence. Clinical T2, these are used on every scan of the spinal cord. And on the right, an MFFE, a multi-emerged fast field echo, a gradient echo. It's the discrimination of white and gray matter is, I mean, you can see the difference between the second and the third picture. One of the challenges in looking at the spinal cord of AMN is that clinically, clinicians will have a T2, a clinical T2, and discriminating white and gray matter on a T2 of the cervical spinal cord is next to impossible. For research purposes, this is extremely difficult if we're talking about atrophy. Because if you think about atrophy, what does that mean? Does that mean the white matter is reduced? Well, we expect that, knowing the pathology, but can we show that? Can we quantify that as well? And without this discrimination, that's extraordinarily difficult. So this new sequence, the MFFE, will allow this. There are similar sequences across the board for Philips, GE, and Siemens with different names, Merge and Medic, and this is readily applied. So what we're doing now as this effort is to cross-standardize. So we take a sample subject, that's myself, and scan in all of these scanners I go in and see if we can replicate these images. And so the third part of my talk, talking about these cross-standardization efforts, is an appeal to clinicians and physicists as well to work together, that I would volunteer to go out to your sites, run these experimental sequences, gather the data, and extend this network of imaging that we've started to create. I'd like to show the difference between, or the similarities between, a scan done at the Vanderbilt University on the left and at Kennedy Krieger on the right. Again, this is the MFFE. The discrimination between white and gray matter is much better than T2. We've also started looking at, here again, showing the comparison to the same registered, so the exact same height. We're looking at the same thing as a T2. We're also doing these advanced DTI sequences. One of them is called Nadi. Just showing the rare numbers would not really mean anything. What it is showing the individual, or mathematically modeling the individual neurites. That means the processes sprouting out of those long nerves in the spinal cord. DTI is able to show the direction of water movement, and this shows within that mathematical model sprouting out to the side those neurites. So thinking about the pathology from recent publication, where there's been damage described to these neurites, or pruning, or loss of volume due to damage here, this would be a method that would image exactly that. So the next steps in this cross-standardization are to add further sites. Like I said, I'm very, very willing to fly out 2 centers that see ALD patients, AMN patients, and add scanning capabilities to this network to develop these sequences and to standardize them. And we are developing these sequences cross-platform now, so extending from Philips, that these were developed on to Siemens and GE. And we have pending proposals to scan AMN patients with these research sequences as well. Thank you very much.
That's great. Yes. This information is of extreme importance for someone like me as a man, an adult man with AMN. What I've come to understand is my disease is a spinal cord disease. That's what's going on. One of my questions is, have you been able to identify particular regions of the spinal cord, cervical, thoracic, lumbar, as being the site or area of the atrophy and damage, or is it done throughout? So I guess my question is, have you been able to identify the structure of the atrophy within the spinal cord?
Thank you. That is a fantastic question, and one that we actively think about and discuss. There are challenges associated with this. So the 1995 publication, which first described the spinal cord atrophy, looked at the thoracic spinal cord. Now, in the thoracic spinal cord, there are very few gray matter neurons that sprout out, because the cervical spinal cord controls the arms and the lumbar spinal cord controls the legs. Yeah. Now, this was with very basic T2 imaging. I say basic, but this was state of the art in 1995. Now, with these modern sequences, one of the challenges that we have for imaging the thoracic spinal cord is movement artifact with breathing. Every time somebody breathes, there is movement there. So there are motion correction algorithms that we're applying to try and replicate these cervical findings in the thoracic cord. So the higher the resolution, the more motion artifact. So what we're seeing is we have to identify a region where we see difference and focus on that. And that's what we're doing with the cervical spinal cord. But which region it is, that would be very interesting. So one of the challenges is the motion artifact. So we're developing this motion artifact correction algorithm, which we're trying to apply. And the other thing is trying to point out where the pathology is on the slice. Is it in the dorsal column where all of the sensory information is ascending? Sure, that's what we think we know, but we think we want to show it too. And for that, we need to be able to really discriminate and say we are looking at only the dorsal column, no gray matter around that. And that's where we need these new sequences with much higher resolution to be able to do that. Thank you.
So key work as we are trying to institute trials and get standardization going. So congrats, Bella.